Hello, my name is Julia Pearson, and I'm a dietetic intern here at James A. Haley. Today, I'll be breaking down step-by-step instructions on how to perform a continuous tube feed education. Let's get started. All right, now that we've prepared and gathered all of our equipment and reviewed all of the safety guidelines, we're ready to go educate our patient. Little bit of a background history. We're seeing a 35-year-old male patient who just recently had a GJ tube placed yesterday. His medical team has confirmed proper placement and okayed him for feeds today.
Before you enter your patient's room, follow your hospital protocol, including knocking before entering, asking for your two patient identifiers,
Do you mind identifying your last four and full name?
And introducing yourself and what you're there for.
So my name is Julia. I'm a dietetic intern here. We received a consult that you're okay to begin feeds today. Do you mind if we take a quick look at your tube?
Once you have washed your hands and/or put on gloves per policy, the next step is to confirm tube placement by verifying the bumper has not changed from where the physician last documented. Once confirmed, you're ready to prepare for your feed.
All right, let's go grab our equipment.
Once you have cleaned your workspace, remove your feeding set from the bag. Be sure to then check and prepare your supplies and feeding set. Label all supplies, including formula, containers, bags, and syringe. Note, labels should include who prepared the formula, the type of formula, and the date and time it was prepared and started. Next, set up your feeding bags. Note that your purple bag will always be for formula and your blue will always be for water. Hang both bags and your tubing on the IV pole. Adjust tubing appropriately to be sure it does not reach the floor. Next, check your expiration dates on formula cartons and clean the top of each with a clean cloth or paper towel. Open the feeding bag cover and measure out the amount of formula you will need for one feeding, or the amount for an appropriate hang time based on setting and formula. Note, to calculate the maximum volume of formula to pour into the bag for safe handling, times hourly rate by maximum hang time. Close the cover and hang the feeding bag back on the IV pole. Utilize the same process to pour the appropriate type of water into your water bag. Next, turn on the pump, press keep setting since it has already been pre-programmed, and load the pump. Once your pump is loaded, the screen will then tell you to prime pump. Note, the pump must be disconnected from the patient at this time to avoid pumping air into them. Find something nearby to prime the pump. Things like a measuring cup or an empty can of formula work well. Remove the cap to your feeding tip and press auto prime. The pump will automatically fill the flush and formula lines. Keep the tip of the tube over a cup in case it drips. Once finished, the screen will read auto prime complete. Then cap your tip and hang back on the IV pole.
Now that we have confirmed placement of the tube, set up the pump, and primed it, we're ready to begin feeds.
The first step is to perform a water flush using your syringe to ensure the tube is working properly. Since our patient has a legacy tube and we have an ENFit syringe, attach ENFit transition stepped adapter to make them compatible. Remember to continue to educate your patient throughout the process. Not only explain how you're doing things, but why, such as elevating your patient's head of bed to at least 30 degrees to avoid the risk of aspiration. Once your patient is in a comfortable position, we're ready to begin feeds. Start by pouring water into a clean measuring cup. Clamp your tube to avoid gastric backflow. Open your tube cap and insert your syringe. Now you're able to unclamp the tube. Use one hand to secure the syringe within the tube. Pour in about 15 to 20 milliliters for a water flush. Due to gravity, the higher you hold it, the faster the water flush will flow. Again, kink the tube, remove your syringe, and cap it. Now that we've assured the tube is working properly via the water flush, we can begin our pump tube feed. Again, note that since our patient has a legacy tube and we have an ENFit feeding set, use your ENFit transition stepped adapter to make them compatible. Then clamp your tube, open the cap, and insert your pump feeding tip. You may then unclamp the tube and lay it flat on a clean surface. Since your pump has already been programmed and primed, you may then press run. Your patient has now started their feeds. Remember to ask the patient if they have any questions or concerns and dispose of any empty formula cartons before leaving. Also, communicate with nursing regarding I's and O's and to update them on what you have done.
Yeah. Hello?
You receive a call from nursing who noted your patient's pump has been turned off. However, they weren't sure why. Time to do some investigating.
We're back for a follow-up with the patient. Let's examine the room and problem solve.
Take a moment. What do you see when you walk into your patient's room? Any initial concerns, safety hazards? Take a moment here to ask yourself, what do you see? The first step is to remove all safety hazards from the room. This includes discarding open formula containers and unlabeled syringes. Then check your pump and feeding set. You notice your patient's pump history is low, likely due to the pump being turned off. You also notice your patient's current hang time is over 8 hours. Note, to find current hang time, take total volume divided by current rate. Dispose of the unlabeled feeding set. The next step is to talk to your patient and team about what's been going on. Use open-ended questions and look for detailed responses. Ask your patient if they've been experiencing any signs and symptoms of intolerance before, during, or after feed. Also confirm that their head of bed was upright during feeds. The next step is to check the tube.
Do you mind if we take another look at your tube?
First, pull tube gently to ensure internal bumper is secure. Verify tube placement. Run your fingers along the tube and open the cap to check patency and look for occlusions. Once you verify that the tube is intact and looks clean, you can then prepare for a water flush to determine if there's an occlusion. Pour in about 15 to 20 milliliters. You notice the water isn't moving and determine there's a clog. Back out the water, detach the syringe, and close the cap. You suspect your feeding tube is clogged. First, try to flush it with 15 to 20 milliliters of water. If this does not work, palpate the tube gently by massaging it between your fingers to physically break up any clogs if visible. If the clog is not visible or other methods are unsuccessful, use your syringe as a little vacuum. Move the plunger back and forth slowly and gently to try to loosen the clog. Note, many patients have tried soda, meat tenderizer, and cranberry juice to remove a clog. However, studies have shown that water is superior as it will not degrade the tube. Patience with water is recommended. Once you have unclogged your tube, perform another water flush to ensure the tube is working properly. You are then ready to set up to start feeds again. Fill feeding bag with new formula. Elevate the patient's head of bed to at least 30 degrees. Reconnect patient to feeding pump, then run feeds. You have now successfully restarted your patient's tube feed. Now that you've seen your patient, how has his room changed? The patient's tube feed has been restarted, head of bed has been elevated into a safe position for feeds, and all safety hazards were discarded and replaced with clean labeled supplies.
All right, Mr. Joe, we unclogged your tube, and again, if you have any questions or concerns, just let us know and we'll come back, all right? Thanks to our help, Mr. Joe is ready to head home with his new pump and receive proper nutrition. Great work today. I'll be Remember, I can always cut out the beginning.
Okay.
That to a success.